Hi, I'm Dr. Roadhouse, and I'd like to introduce you to my patient, Patsy Palmer. And Patsy's in our thyroid program. Patsy, why don't we talk first about the symptoms that you had before you came in to see us? So, what were some of the symptoms that you had?
Most of my symptoms were fatigue
Okay.
and having a hard time going to sleep. And then when I went to sleep, staying asleep was another challenge.
Okay.
And some of the coldness and the heart palpitations that I would have off and on. And memory and concentration has been a big challenge of mine recently. And I'm slowly but surely getting over a lot of that.
Okay.
A lot of that's being recalled.
Okay. Talk about your the fatigue and stuff. Like, how did that affect you? I mean, like when you woke up in the morning, were you already tired, or were you okay? And then it got better. Kind of explain that.
I would wake up tired. My body just felt like I just can't get up and function normally. And I was able to keep my housework done and do light cooking. But my husband was always very good about, helping me. He had to because I just couldn't function like I normally did.
So if you did do more than the housework and the light cooking, what would happen?
I'd have to go lie down for about 2 or 3 hours.
Okay. All right.
And I still nap daily.
Yeah.
Because I realize I need to do that
Well,
to kind of rejuvenate
you're still recovering.
Right.
Okay, so as far as the sleep issue, talk a little bit more in depth about that.
I'm able now, I'm seeing a big change in my sleep patterns, and I can go to sleep easier and without the help of medication.
Okay.
And
are you able to stay asleep? And if you do wake up, are you able to go back to sleep right away?
Yes.
And you
Sometimes
do
it
that,
takes me a little while, but it's not near like it used to be. It used to be hours before I could go back to sleep, but now it seems to be pretty rapid.
Okay.
I may have to get up during the night, but then I can go back to sleep and lie down and just go right back to sleep. So.
Yeah, and you haven't been in the program too long, so we're coming along really good. What about the heart palpitations? Talk about that.
I haven't even noticed those. I can't even tell you when they stopped.
Yeah, and one of the signs that we saw, when you came in, the heart palpitations. That's usually one of the 6 patterns of thyroid dysfunction that doesn't respond to medicine, and also autoimmune Hashimoto's. So as far as that goes, how are you feeling? As far as just overall like weight loss, how have you done? Because you had a big problem with that in the past.
I have. I've never really been overweight. Now my sister was, but I've never been overweight because I was always very careful and tried to keep my weight down. But I did gain some, but I've dropped. I have no idea how much I've lost now, but maybe 15 pounds.
Yeah, and you weren't that heavy, but you did have a difficult time losing that 10 to 15 pounds with the other methods that you tried before you came in, even on the low calorie diets and stuff. You had a hard time losing. So we did all the lab work and stuff, and we found a lot of things in the lab work that that no other doctors ever looked for before.
That's right.
And we found that you had some problems with gluten, with eggs, with teff, and a lot of patients that have a problem with gluten, they'll say, oh, well, you can eat teff and replace it. Well, if we didn't do this test on you, find you had a problem with teff, and this test says that whatever you eat, the teff, it's just like eating gluten. So you've been doing the gluten-free diet and still would have had a lot of problems. But the gluten-free diet itself is not the only thing that we did for you, because we found so many other things. We found a lot of things that you can do, and you've adjusted your diet that way, and your energy levels coming back.
Yes.
Talk about the stomach stuff, the intestine, and all that.
I don't have the gas that I used to have.
Okay.
My system is just really I might say just calmed down to where I'm eating the right type of foods now, pure foods, and my whole system is just calming down. You know, and I don't
Well,
have
you're not
to
having all the gurgling.
No.
You're not having the bloating
The
anymore.
gas,
You know how your
yes,
stomach
yeah.
used to bloat out and stuff like
Right.
that. And your bowel movements are getting back to normal.
Yes.
And so that's the, you know, with the thyroid problem, I mean, it's neurological, but
Yeah.
it's also intestinal. And
That's
if
right.
the intestine's not working right, you're not going to get a good blood supply to the brain.
Well, when the thyroid acts up, everything acts up.
That's right, yeah. So overall, you're doing really good. So I think
Right.
what we'll do is we'll check back in with you in a little bit. But
Okay.
right now, you're pretty happy with the results?
Oh, I recommend it all to anybody.
Okay, is your husband pretty happy too?
Yes, he is. He
Okay.
sees the only my sons. They say, "Mom, you're losing weight." I said, "Thank you."
Yeah. All right, well, thanks, Patsy, and we'll check in with you in a little bit.